Next, we'll talk about family planning. So family planning can mean a lot to a lot of different people. Sometimes it's the timing of pregnancies. So maybe they want to space pregnancies out a couple of years, or maybe they're starting a career and they're not ready to have a child yet for a few years. So it could be timing, it could be the number of children. So maybe they only want one child or two children. They can use family planning methods to be able to attempt to achieve that goal. Some people don't want any children, and so that is another goal that you may have patients that are interested in. 37% of U.S. pregnancies are unplanned. That's a significant number. And we're going to talk in a moment about preconception planning and why that is so important, and how that 37% of unplanned pregnancies is really can be problematic because there has been no preconception planning. So the goal for family planning is just the best case scenario for mom and baby, and to really get that family started off on a good foot. So preconception planning, the most important, or one of the most important aspects, is making sure mom gets adequate amount of folic acid. We talked about spina bifida, I believe, in 113, and what all that entails. Well, that is closely tied to low levels of folic acid preconception. So while we want moms taking vitamins while they're pregnant, the folic acid has to be on board in that mom preconception, so before she conceives. So if you've got 37% of moms getting pregnant and not intending to, they probably are not taking folic acid. Ideally, every woman of reproductive age is taking some sort of folic acid supplement to be able to make sure she meets that need. And there are folic acid fortifications in a lot of the products that we eat, cereals and breads in particular, but that's an important thing, and studies show that it helps so much to decrease spina bifida and spinal cord defects. So that's a huge teaching point. So any woman of reproductive age needs to be making sure she gets enough folic acid. Preconception planning, we can also look for things like chronic illnesses. So if a mom is diabetic or pre-diabetic, or has something like rheumatoid arthritis, or trying to think of another example, any kind of chronic issue, hypertension, then we could be able to address those before she gets pregnant, which is always easier to do versus having to deal with a chronic condition with the baby on board. So addressing those issues and identifying those issues before she gets pregnant is important. Some families have genetic issues that run in their family, or genetic conditions, and so if they know this, then they can screen those parents beforehand and be able to have some ideas, the likelihood of that baby being potentially involved. So preconception planning is very important. Contraceptives are also part of that family planning aspect. One thing to consider, and to make sure your parents know, or patients know, that all contraceptives have a failure rate. They're going to be 100% guaranteed unless you completely take out a uterus. That would be your only way to be ensured that you're not going to get pregnant. There are lots of options and lots of opportunities now, lots of choices for patients. You can actually get oral contraceptives online now and not even have to go to the doctor. Makes me a little nervous, but that is out there. So there's no excuse these days for individuals not to be able to access some sort of contraceptive. So really that 37% failure rate is kind of crazy when you think about it. Patients just sometimes are afraid to ask, or they don't know, or they're uncomfortable talking about it, and so a lot of times that will lead to unintended pregnancies. So being forthright and having information to share with your patients will be beneficial. So they kind of break down to about 3 categories of contraceptives. So you've got hormonal, so those are things like the Depo-Provera shot, which you may have heard of, it's been around for a while, oral contraceptive pills that have been around since the 1960s. The patch, there's a ring, a vaginal ring that you can insert that has hormones embedded in it. There's barriers, so those are like male and female condoms. IUDs, there's actually an IUD that has hormones embedded in it, so it's both a barrier and a hormonal aspect. Male-female condoms, diaphragms, cervical caps, those are barriers as well. And then surgical, so that would be like a vasectomy or a tubal ligation on a female, which are considered permanent sterilization. They can be sometimes reversed, but we consider those to be permanent, but they are still not 100% foolproof. So infertility, that by definition is a lack of conception despite unprotected sexual intercourse for at least 12 months. So you'll have individuals that get frustrated, they're not pregnant yet. Why can't we get pregnant? We want a baby. How long have you been trying with unprotected sex? 3 months. So that is not yet considered infertility, so they have to go a full year. About 15% of American couples are going to deal with this, so it's a pretty common issue. About 1% of U.S. babies that are born in the United States are conceived by some sort of fertility assistance. So that can be in vitro fertilization, artificial insemination, sometimes it's medications. There's a variety of ways that we can help patients try and get pregnant if they want to. It all boils down to about a third of the time it's a male issue, a third of the time it's a female issue, and a third of the time they never really are able to determine who the issue is with. So it's across the board. There's fertility assistance that patients can come into, and there's a physical approach, which is artificial insemination. Basically, you're going to take sperm and semen from the male and artificially inject it into the female at the right time for conception to occur during ovulation. It a lot of times will help, particularly if there's sperm motility issues, like the sperm just cannot swim, or if mom has a hostile birth canal, and whether it's physical or chemical makeup of the way she is structurally made, it is not inviting to sperm for them to be able to survive in that environment. So you will see that used. It's a little less invasive compared to the chemical or physical approach, which is in vitro fertilization. This requires mom to be on hormones, pretty significant hormones, a lot of timing. They're going to capture an egg, they're going to take sperm, and basically within a petri dish create an embryo, and then that embryo is then re-implanted back into mom. A lot of times more than one embryo is going to be re-implanted, so the chance of multiples increases. In vitro fertilization has only about a 35% success rate. So, 1 in 3 couples that do try and get a baby from that will actually end up with a live baby at the end, and it costs more than $8,000 per round. And then, of course, that doesn't guarantee a baby, so that's a significant investment for those patients. And that wraps up the end of our first part of sexuality.